Guys, welcome to Fun Learning. In this video, we are going to discuss about the capsule and the ligament of hip joint, capsular ligamentous tension and the trabecular system. With no further delay, let's get started. Fibrous capsule or hip joint capsule. Fibrous capsule of the hip joint act as a covering of the hip joint surfaces. In hip joint, the capsule contributes substantially to the stability of the joint. Now, let us discuss about the attachment of the hip joint capsule. Anteriorly, it arises from the rim of the acetabulum and it is attached to the intertrochanteric line. Posteriorly, it arises from the rim of the acetabulum and attached 1 cm medial to the intertrochanteric crest. I hope so you know the mnemonic clap. In that C stands for intertrochanteric crest, L stands for intertrochanteric line, A is anterior, B is posterior. Intertrochanteric crest is present at the posterior aspect of your femur, whereas intertrochanteric line is present at the anterior aspect of your femur. So this hip joint capsule, both at the anterior as well as the posterior aspect, it arises from the rim of the acetabulum, but at the anterior aspect, it is attached to the intertrochanteric line, and at the posterior aspect, it is attached to 1 cm medial to the intertrochanteric crest. Now let us discuss about the types of fibers that is present at the hip joint capsule. So they are nothing but the longitudinal fibers, oblique fibers, and there are 3 capsular ligaments. First, let us discuss about the longitudinal fibers. These longitudinal fibers are more in number when we compare these fibers to that of the oblique fibers. And these fibers are present at the outer aspect. That is, it is found in outer space or outer fibers and it is attached to the periosteum of the bone. I hope so you know what is periosteum of the bone, which is nothing but a covering of the bone. Now let us discuss about the oblique fibers. So these oblique fibers are less in number when we compare this to that of longitudinal fibers. At the neck of the femur, these fibers differentiate into a collar-like structure that is referred to as the zona orbicularis, via which the retinacular fibers, which get originated from the medial and radial circumflex artery, enters to provide nourishment to the head of femur. And there are 3 capsular ligaments which we'll discuss later. So I hope so that you can see this diagram. So this collar-like structure is referred to as the zona orbicularis, via which the retinacular fibers travel to provide nourishment to the head of femur. Now let us discuss about the ligament of the hip joint in detail. First, let us discuss about the ligamentum teres, which is also known as ligament of head of femur, and the round ligament. This ligament arises from the fovea and it is attached to the acetabular notch. This ligament is triangular in shape. As it is triangular in shape, it has an apex, it has a base, and it has 2 borders. Apex attached to fovea capitatis, base is attached to transverse acetabular ligament. Borders, both the borders are formed by the medial and lateral margin of the acetabular notch. Now let us discuss about the function of this ligament. So when hip flexion is greater than 90 degree, this ligament is going to restrict both medial as well as the lateral rotation. So what is the function of this ligament? So when hip flexion is greater than 90 degree, this ligament is going to restrict medial as well as the lateral rotation. I hope so you can see this diagram. So this is nothing but the ligamentum teres. Its apex is attached to fovea capitatis. Its base is attached to transverse acetabular ligament, which spans both the end of the acetabular notch. And both the border of this ligament is formed by the medial and lateral margin of the acetabular notch. Now let us discuss about the capsular ligament in detail. I hope so you can see this diagram. So there are totally 3 capsular ligament. 2 capsular ligaments are present at the anterior aspect, whereas 1 capsular ligament is present at the posterior aspect. Now, let us discuss about the iliofemoral ligament. There are totally 4 points to discuss under this ligament. First point is nothing but when we closely look at this iliofemoral ligament resembles an alphabet, which is nothing but Y. So, this ligament is also known as Y ligament or ligament of Bigelow, which is the first point. Second point is that this ligament is one of the strongest ligament in our body as well as in the hip joint. Third point is that this ligament arises from the anterior inferior iliac spine and it is attached to the intertrochanteric line. Fourth point is nothing but the function of this ligament. So this ligament, as it is present at the anterior aspect, it is going to provide the anterior stability to the joint. as well as this ligament is going to restrict the lateral rotation when the hip joint is in flexion and neutral position. So there are totally 4 points. This ligament is also known as Y ligament or ligament of Bigelow, and this ligament is one of the strongest ligament in the body as well as in the case of hip joint. Third point is that this ligament arises from the anterior inferior iliac spine and it is attached to the intertrochanteric line. Fourth point is that it is going to provide anterior stability to the joint as well as it restricts the lateral rotation when the hip joint is in flexion and neutral position. Now let us discuss about the pubofemoral ligament. So this ligament arises from the iliopubic eminence, obturator membrane and obturator crest, and it is attached to the neck of femur where it blends with the capsule of the hip joint as well as the iliofemoral ligament. This ligament, which is also present at the anterior aspect, is going to restrict the lateral rotation when the hip joint is in extended position. So this is going to restrict the lateral position when the hip joint is in flexion and neutral position. This is going to restrict the lateral rotation when the hip joint is in extended position. Now let us discuss about the ischiofemoral ligament. So this ligament arises from the ischium. Some fibers attached to the femoral neck, some fibers attached to the greater trochanter, and some blend with the joint capsule. So some is attached to the femoral neck, some is being attached to the greater trochanter, and some blends with the joint capsule. And this ligament, this is the only ligament which is present at the posterior aspect. So this ligament is going to restrict the medial rotation regardless of the hip position. Whether your hip position is in flexed position or your hip is in extended position, this is the only ligament which is going to restrict the medial rotation. Now let us discuss about the capsuloligamentous tension in detail. Let us discuss about the capsuloligamentous tension. Under this topic, we have 4 points to discuss. First one is a closed pack position. Second one is a open pack position. Third one is a vulnerability position. And fourth one is nothing but the position of the hip joint where your capsuloligamentous tension is least. Closed pack position. Full extension is referred to as the closed pack position of the hip joint. Full extension of the hip joint because this position draws the strong ligament of the joint tight, resulting in stability. Open pack position, flexion, abduction and external rotation is considered to be the open pack position of the hip joint. What is the vulnerability position? Cross leg sitting is considered to be the vulnerability position where your hip joint will be in flexed and adducted position. A strong axial force through the femoral shaft towards the hip joint may push the femoral head out of the acetabulum. Capsuloligamentous tension is least when the hip is in mid-range flexion, slight abduction and mid-rotation. In this position, the normal intra-articular pressure is minimized and the capacity of the synovial capsule to accommodate abnormal amount of fluid is greatest. This is a position assumed by the hip joint when there is pain arising from the capsuloligamentous problem or from excessive intra-articular pressure caused by extra fluid in the joint, which may be because of synovitis of the hip joint or bleeding in the joint from tearing of blood vessel with a femoral neck fracture. Minimizing the intra-articular pressure not only decrease the pain in the joint but also prevent the compression of the intra-articular blood vessel that supply the femoral head. So what is the closed pack position? Full extension. What is the open pack position? Flexion, abduction and external rotation is considered to be the open pack position. What is the vulnerability position? Cross leg sitting. That is where your hip joint will be in flexed and adducted position. When the capsuloligamentous tension will be least, when the hip joint is in mid-range flexion, slight abduction and mid-rotation. Okay, now let us discuss about the structural adaptation to weight bearing in detail. Now let us discuss about the structural adaptation to weight bearing. First, let us discuss about the line of weight bearing. The weight of your head, arm and trunk from the vertebrae of the spinal column will transmit to the sacropromontory. From there to the sacroiliac joint, from the sacroiliac joint to the acetabulum. At the acetabulum, the weight of your head, arm and trunk will divide into two equal halves. One half will get transmitted to the right femur, other half will get transmitted to the left femur. Okay, as I said, half HIT will get transmitted to one femur. So half HIT acts. In order to counteract this force, we need another force. Here it is nothing but the ground reaction force. Whenever there is two forces equal in magnitude, opposite in direction, act on the same object at two different points, this two force is considered to be the force couple. So whenever there is a force couple, we should have a moment arm. Here the moment arm is nothing but the perpendicular distance between the ground reaction force and the head arm and trunk force. As a result of these two forces, we have a tensile force that acts on the superior aspect of your femoral neck and the compressive force that acts on the inferior aspect of your femoral neck. Bone naturally responds better to compressive forces than the tensile forces. If the bone cannot handle the bending moment across the femoral neck due to the presence of large tensile load across the superior portion of the femoral neck, then fracture will occur. In order to counteract this, we have a specialized system referred to as the trabecular system. So we have two major and three minor. Two major is nothing but medial trabecular, lateral trabecular, and three minor is nothing but secondary compressive system, secondary tensile system, and the trochanter system. Now let us discuss about the medial compressive system. So this medial compressive system arises from the medial cortex of the upper femoral shaft and terminate on the superior aspect of the head of femur. Whereas a lateral tensile system arises from the lateral cortex of the upper femoral shaft, crosses the medial compressive system and terminate on the inferior aspect of the femoral head. So this medial compressive system arises from the medial cortex of the upper femoral shaft and terminate on the superior aspect of the femoral head, whereas the lateral tensile system arises from the lateral cortex of the upper femoral shaft, crosses the medial compressive system and terminates on the inferior aspect of the femoral head. The area in which the trabecular system cross each other at a right angle are area that offer the greatest resistance to stress and strain. This area is considered to be the zone of weakness, where the trabecular system are thin and do not cross each other. And this area has less reinforcement and thus more potential for failure. Not the entire acetabulum will take part in the weight bearing. Only the superior portion of the lunate surface will take part in weight bearing. Same is applicable to the femoral head also. Only its superior portion will take part in weight bearing. The contact area was found to be significantly smaller in female than in men with associated high peak contact stress. Whenever there is excessive weight bearing, there will be degenerative changes that occur in the dome of the acetabulum as well as the degenerative changes of the femoral head, which include the loss of the regular ball shape with flattening of the superior portion. Full loading of the hip joint is necessary to achieve congruence and optimize load distribution between large femoral head and acetabulum. Incongruence of the acetabular dome in the moderately loaded hip could result in incomplete compression of dome cartilage and therefore inadequate fluid exchange to maintain cartilage nutrition. As we all know, cartilage is avascular in nature. It gets nourishment only via the synovial fluid. This synovial fluid will enter the cartilage only during the loading, when the loading of the joint occurs. So, if there is no loading of the hip joint, then the cartilage may not receive the nutrition, and that may result in the damage to the cartilage. Too little compression or excessive compression can limit nutrient exchange that may lead to compromise of cartilage structure. With this, I am completing today's video. Thanks for watching. Stay home, stay safe. If you like my video, please subscribe to my channel. Thank you.